Jones. He's a 49-year-old man, recently divorced, just lost his job at the local factory 6 months ago. He was referred to our program for screening positive on his PHQ-9. He had a score of 21. 2 weeks later, he had another PHQ-9 and he had a score of 18. He also has a history of depression. He was on an antidepressant when he was 30 years old, but for about a year, and he stopped it on his own. Right now, he's having trouble paying his bills. He's sad that he can't see his children because his ex-wife, who has custody, has moved out of state. And I think the only joy that he has in his life right now is his dog, Buddy.
Wow, he has a lot going on right now.
Definitely.
And any pertinent medical history or substance use history?
He recently was diagnosed for high blood pressure. He attributes it to all the stress that he's been going through. He was given the audit for alcohol use and scored negative.
Mm-hmm.
And he was given the DAS for other drug use, and he also was negative on that as well.
Okay. And how long has he been depressed?
It's been about 3 months now that he says he's been feeling down. He's not feeling any better, not doing the things that he usually enjoys. He's not sleeping well either. He goes to bed about around 10 p.m., doesn't fall asleep until midnight. He takes naps during the day, so that might also affect it.
I see.
He has low energy, trouble concentrating, reading the paper. He did deny any thoughts of having suicide. I believe that most of this surrounds the fact that he was at his job for 20 years, and he feels right now that he is not a man without his work, is what he said.
Okay. And how does he look like in the office?
On my first interview, he had a sad affect, very tearful when he was mentioning his children, and then in the second interview, it was the same thing.
Okay. So it certainly sounds like his depression has come back, and you mentioned that he was treated about 20 years ago with an antidepressant.
Mm-hmm.
Did he mention which one that was?
It was fluoxetine, and when I asked him about it, he said he wasn't sure if it had worked for him or not.
Okay, and has he had a history of hypomanic or manic symptoms in the past?
I did complete the CD3 with him,
Mm-hmm.
and he was negative for bipolar disorder. And he also let me know that he doesn't have a history of family history of bipolar disorder.
Okay, so he doesn't have an elevated risk for bipolar disorder. Anything else we should talk about before moving on?
I don't think so. Well, we are working on behavioral activation. He mentioned in the past an activity that he liked to do was to walk his dog. So we're trying to schedule that for him to start walking his dog more, as well as also other things, a part of his behavioral activation. And I did talk to him to see if he was open to trying a new antidepressant.
Wonderful. So his depression has been persistent for about 3 months now. I do think it's time to start an antidepressant, and the one that comes to mind is bupropion.
Let me write that down.
Sure. So it's also called Wellbutrin, and this medication could be good for him because it can address both his depressive symptoms as well as his smoking. So this medication can help to reduce the number of cigarettes he smokes. And it's great that you are working with him on behavior activation. I know you've had lots of success in the past with other patients.
Awesome, because he did mention to me that he wants to cut down on smoking, and he's found it really hard to do.
Okay. So one consideration is also that this medication isn't for patients with seizure disorders or eating disorders. So we should make sure that the PCP documents that that's not the case. And it's also a bit more activating than other antidepressants, so it should be taken in the morning and not in the evening. Otherwise, it would disturb his sleep even more.
Okay, I'll be sure to let him know that it probably might not kick in until a couple weeks from now, and that we may need to do some adjustments in the beginning.
That's right. And how's his sleep hygiene?
So I did mention that he does take naps during the day, and I mentioned to him that that may not be helpful to his sleeping problems. So right now we have him filling out a sleep log each
Great.
night, so we can review it with him next visit.
Wonderful. Anything more for this patient?
I don't believe so. I'm gonna see him next week.
Okay, so we can move on to the next case?
Yeah, definitely.